Welcome, Tasha Jennings, to the Fertility Queen podcast, and this will be a series of podcasts to help women and men achieve a pregnancy. So we're going to inform them and give them the best chance possible moving forward of having a healthy baby. And tell us a little bit about yourself, Tasha, and how you started and why you're so passionate about what you do.
Look, I'm very passionate about helping people have healthy babies, and I love working with your patients to help create the outcomes that you're able to afford to them. But as I said, I'm a naturopath and nutritionist, have been for the past nearly 20 years now, studied at the Melbourne College of Natural Medicine and upgraded to a bachelor at the Victoria University. And I've really probably been the last 8 years that I've been focusing purely on fertility and pregnancy, and probably for largely selfish reasons initially, as was having difficulty falling pregnant. So I really became passionate about doing everything I could to help us conceive and carry a healthy baby. And
why were you struggling to conceive? What was happening in your life that was making it hard for you to conceive?
Largely, and I think I see a lot of, this type of person in my clinic now, which I think high stress, probably type A personality. I was flying all over the country. I did a home brand vitamin range that I created for a pharmacy company, and so I was flying nationally, running trainings, just overworking, and realised that, to be honest, even while we're trying, I was not ovulating. Everything had shut down for me. I was far too overworked. So fortunately, we were able to conceive, and we now have a beautiful 5 and 8 year old. But I really wanted to learn more about, obviously my background was in product development. I really wanted to create the best nutrition I could to fuel that growth and development, particularly in the 90 days that we talk about a lot prior to conceiving, which is so important.
And what do you think made a difference to you back at that time when you got pregnant with your first child?
It was learning to manage the stress, and I ended up quitting my job, to be honest, and purely focused on nutrition and getting the right balance of nutrients. And I know we'll touch on this when we talk, but the MTHFR gene is an issue that I personally had. So I needed to navigate that and make sure my folate metabolism was optimal. And that's really, and choline as well, which is important for folate, for the neural tube development and that homocysteine pathway, which is really critical. And they now show that an optimal homocysteine pathway in follicular fluid, it creates better embryos and better quality embryos and more chance of a pregnancy. So those were the main issues for me, that in combination with stress and ovulation, which obviously are having to get that happening again, was able to conceive. But that's when Zycia Natal Nutrients was conceived.
Yeah, so tell us about your product. So it's Zycia Natal Nutrients, and why did you develop this?
I developed it because I had obviously a strong background in product development. I knew products inside out, and I know there is a lot of different forms of each nutrient. Some which are going to be actively metabolized and used in the body and absorbed. Others just look great on the packet but aren't actually very well metabolized into the body. So I really wanted to create a tablet to help me conceive with all of the nutrients I wanted in there that I knew were going to be well metabolized and absorbed, actually getting to where they needed to be to fuel that beautiful growth and development.
What made you create this vitamin, and what does the name mean?
The name actually means life, which is what I'm really passionate about, is nurturing and nourishing life in its earlier stages. So it actually means life in Polish. So not that was any background of mine, but I just loved the name and I loved what it meant. And so Zycia Natal Nutrients is really all about creating and nurturing and supporting life in its earlier stages.
And I know that a lot of the vitamins you buy off the shelf, they're not as good as what's in your product and some of the other brands that are behind the counter. But there's a lot of marketing around those products that makes you feel like you should buy that one. And I know a lot of my patients do intake or a lot of the commercial products. And so what's different about your vitamin compared to a lot of the ones that are more commercially available, I would say, I suppose, yeah.
Well, it's firstly looking at what's in there and what nutrients are in there and what form of nutrients in there and what dose. And that's where my book, The Vitamins Guide, that I wrote a number of years before Zycia actually, is all about looking at the back of the packet. I love educating, not just about, yes, it's A to Z and it's got all these flashbang claims on the front of the packet, but actually what's in there, what form is that nutrient in and what dose is it in, and is it going to be properly metabolized? Because, for example, iron should not cause black stool and constipation, which
No.
so many patients struggle with. So the number one,
Yeah.
I guess, feedback I get is, I feel so well on your product. And that's because the nutrients aren't sitting in your gut
Yeah.
causing those issues. They're actually being metabolized and absorbed.
I've actually started taking your vitamin and I feel like it makes me feel better. And it's got a high level of vitamin D in it as well, hasn't it?
Absolutely, and vitamin D is so critical. It's linked to low AMH, which is obviously really important and becomes an issue as we age. It's important for egg quality, and it's also one of the few nutrient deficiencies that we can pass on to bub. So during pregnancy, a lot of the time bub will get everything they need. They will leave you deplete, which is another factor we want to consider, but they will get everything they need. But vitamin D, you can pass that on to bub, and it's really important for their bone development in utero and also when they're young as well. So it can affect their growth and development.
Yeah, and it also affects egg quality and how we ovulate as well.
Absolutely.
So there are parts of the world where there's lack of vitamin D, and there are studies that show that those countries, the women are more infertile. So vitamin D is very important. I always measure vitamin D on everyone and try and get their levels up to around 100.
Yeah, I think we're in agreement on that. I think so many GPs will tick you off at 50.
Yes.
But really, you want to go into a pregnancy with 100 and you really want it for that egg quality, for embryo quality and for the health of the pregnancy, you want to have good, healthy levels.
And I've had patients where all I've done is corrected their vitamin D and they've got pregnant naturally. So it's pretty amazing.
Great. Yeah. So, yeah, vitamin D and folate.
Yeah, so let's talk about folate. Why do we need folate?
We can't sustain a pregnancy without folate. It is that critical to DNA development. And unfortunately, we're totally reliant on dietary sources for folate. We don't produce any, so we need to get it from our diet. The difficulty these days, because I get told a lot, look, my grandma, she had 6 kids and she never had any multivitamins, so why do I need to take a multivitamin? The thing is, folate is an extremely unstable nutrient. If it's processed, if it's overheated, it's lost. So a lot of, basically any food with a barcode, I'm generalising, but any food that's been processed is lacking folate. So what they do is they substitute that lack of folate with folic acid.
Yeah.
Now, folic acid is a synthetic supplemental source of actual folate that our body's utilising and can help create that beautiful embryo, that beautiful egg quality and help with the pregnancy. So we really need actual folate. So getting it from dietary sources still paramount. A multivitamin I see as your insurance policy, just to make sure you've got a baseline of key nutrients. It's never a replacement for healthy diet. So getting plenty of greens, getting them as close to the source as possible, your backyard would be great, farmer's market or a grocer, just so they're not. I had some asparagus the other day that came from Mexico when it arrived in my delivery. So just getting them as close to the source, high folate.
And folic acid decreases your risk of spina bifida, which is a neural tube disorder.
Yes.
So if you don't take folic acid, you are increasing your risk of that occurring. And that can affect the little baby in lots of different ways and sometimes leading to complete paralysis. So it's very important that we take our folic acid and try and lower our risk. And if we do have other medical conditions such as diabetes, or we've had say something like Crohn's disease, you should consider taking a higher dose of folic acid to increase your absorption.
Yeah, that in combination with folinic acid, so you're getting the active form as well. So you're getting, because the absorption of folic acid is quite, folate is quite cyclical. So it's feeding it from a few different pathways, getting some food sources, getting some folic acid and getting some folinic acid. And that's why I put both folinic acid and folic acid in the supplements. So you're feeding it from a few different pathways to maximise that absorption. And that's where also checking what your levels are and not just getting a folate blood test, but also testing homocysteine, which I know you do in so many patients. And as I mentioned, the homocysteine pathway, having that optimal in follicular fluid actually can increase the health and outcomes for that pregnancy.
And we know that elevation of homocysteine can be linked to miscarriages.
Yes.
So that's one of the tests we'll do if someone is suffering from a miscarriage, and that's all got to do with the folic acid pathway as well.
It does, because a folic acid blood test or a folate blood test, which a lot of people get, that can show as high. And it's like, oh, tick, great, you're high levels. But that's showing that it's high in the bloodstream. It's not showing whether it's actually being metabolized and absorbed. Whereas homocysteine, having that between, look, I like to see it between a 6 and an 8, having that around that level indicates that your body is actually metabolizing the folate and using the folate. So, yeah, it's a marker of how well your body is metabolizing those folates.
And then we'll get on to choline, because your vitamin preparation does have choline in it. But a lot of the off-the-shelf vitamin nutrients out there don't have choline in them. So what's so good about choline?
Choline is now being recognised. I know I saw a headline, it's the new rock star prenatal nutrient in the US, and that's because it works alongside folate. And so we know folate is, as you said, it's critical for that neural tube development, preventing spina bifida, miscarriages, unfortunately some dire consequences of not having sufficient folate. But we now know choline works alongside folate in the development of the neural tube, and studies now show that high choline levels are actually linked to better outcomes, and low choline levels are linked to, unfortunately, more risk of neural tube defects. So much so that the American Medical Association have recommended that choline be in all prenatal supplements, but obviously there's a lot on the market that still don't provide choline.
So check your vitamin list on your prenatal and check if it does have choline in it, and if it doesn't, you should go to your pharmacist and ask for a natal vitamin that does have choline, such as your one.
Yeah.
And what about vitamin B12?
Vitamin B12, I feel like, is the forgotten nutrient in DNA creation, because there's 3. There's iron, folate, and B12, and we focus so much on folate and iron when, most women know about those 2 nutrients when we want to fall pregnant. But B12 is super important in that whole pathway. So just getting healthy vitamin B12 levels, just get your blood levels checked. It's fairly easy to boost vitamin B12 levels. So getting a good dose, though. A lot of prenatals will provide a very low dose of B12 and a very high dose of folate. Folate is about B vitamin. It's B9, and they're a B complex. They should be taken together. So I recommend, if you're taking 500 of a combination, folinic and folic acid, taking around the same amount of a B12, which is what I've got in Zycia, but taking a good dose of B12 alongside your folate is important.
And that's one of the tests I do on patients, their B12, and there's so many people have deficiency they wouldn't have known.
Particularly for sperm health as well. So that's particularly important for morphology.
And so we do, we talk a lot about egg health. Let's talk a little bit about sperm health. What can guys do to improve their sperm?
Now, there's lots guys can do to improve their sperm. The biggest thing they can do is avoid environmental toxins. They are very much linked to seminal issues, and it's found in seminal fluid. So BPA is actually found in seminal fluid and follicular fluid, and it's linked to better outcomes if we have less of that. I think the top 80% of BPA, intake had far more risk of miscarriage and complications. So we really want to minimise any toxins. The good news is most of them are out of your system within 2 weeks. It's just because we're constantly exposed. So swapping your plastics out, getting some glass and stainless steel, optimizing your zinc levels is really important. And anyone with gut issues, funny enough, I always ask them, do you get bloated? Do you get constipation, diarrhea? Zinc actually helps to create hydrochloric acid in the body, which helps to break down our food and digest it and pass it through. So if they've got those sort of issues, I will think zinc, because that can help their digestion, and it also is really important for reproduction and testosterone production and sperm health. So zinc is super important. Folate, B12, just as important for men, particularly for the morphology, and I do like to break that down. And ideally, I'd like to see morphology put above an 8 at least, but I often see them around 4 or 2 or Well,
the cutoff has now changed. So it used to be 15% normal that you used to have to be a normal semen analysis, and now it's 4%. So the cutoff has changed because so many men have abnormal sperm. And yes, I agree. I like to see that abnormality lower and have the normal forms around 8% as well.
Yeah, and I think it's really good for them to realise that. And I do often show them a chart to show them where they are compared to where ideal is, because a lot of them will get ticked off at 4 and think, I'm fine, there's nothing wrong with me, and particularly recurrent miscarriage as well. I can get her pregnant. It's her problem that she can't carry the pregnancy. But sperm health is impacted by, right, well, generally anything before 10 weeks can be a sperm issue, because both create the embryo, and it's an embryo issue that causes those most likely complications. So sperm health, super important. So men need to get onto a good multi as well, clean their diet up, get rid of toxins out of their system as much as they can. Yeah.
And stop smoking.
Definitely stop smoking. Yeah, it's a huge one. And again, the good news is these are generally reversible. You're producing a new batch of sperm every 90 days, just like we talked about with the egg. The egg is optimized in that 90 days. And they're now finding with age-related infertility for men and women, who men are affected too, you can actually improve the egg quality. It's generally not that you've got worse eggs. It's just that the environment that that egg is developing in is not as great as it was when you were 20. You know, you're producing less coenzyme Q10, you're producing less melatonin, you're being exposed to more toxins over the time. There might be thyroid issues, you might have liver issues. It's basically, if we can improve that environment, and that's what I obviously work on with my patients, is if we can improve the environment that that egg is developing in, then we've got a better chance of producing a healthy, viable egg, even if it is low AMH. We've got low reserve because we get lower reserve as we age. It's about getting that quality egg.
And there is a misconception with guys. Oh, it's all the egg's problem. It's my wife's problem or my partner's problem. I really don't have much to do. So I'm fine. I don't need to look after my health. I can eat what I want, smoke cigarettes, drink what I want. But that's not actually true, is it?
Not at all, not at all. And I always see the couple, and I do have some women come to. I do see single women as well, wanting to, have helped a few have a sperm donation or egg freezing on their own. So I do have a package where I work with them as well. But anyone I speak to, I say, look, that package is purely if you are wanting to do it on your own. If you have a husband or a partner, I really want them involved. Even if they've been ticked off as, yep, okay. If we can get, I call them Olympic athletes. If we can get Olympic athlete swimmers, we're far more likely to create a pregnancy if we've got something that's, it's within range and it's okay. So what he does in those 90 days makes a massive difference. And the good news for men is we can make a huge impact on sperm health. And that's why I like to focus on the men too, because if you have got someone who has a really low AMH and her egg reserve is really going to struggle, we do need to work hard to create that pregnancy for her. If he can do the work and get awesome sperm, that's going to help so much to create that pregnancy.
And it does become difficult when you've got an older egg and an older sperm, and the sperm has abnormalities, because then we've got the older egg, the older sperm, and the sperm's abnormal. So then we're injecting not so great sperm into that older egg, and that older egg can't fix up that abnormal sperm, whereas a younger egg might have better capability of doing that, but the older egg can't. So we do need the sperm to be as healthy as possible, so to give you the best chance of having a healthy embryo.
Absolutely, because, when our eggs are young, and I like to joke with my patients, that's it, probably when we're young, we do like to biologically fix up our men, and we do that at biologically level. We joke that we're meant to get men, and we fix them up, we make them better, and as a biological level we do that. But as we age, we have less energy, less capacity, so the egg has less capacity to fix issues within the sperm to go on to create a pregnancy, whereas a younger egg with more energy might be able to get that okay swimmer and go, let's just make a few changes and get a pregnancy. But we can't do that if it's an older egg. So if we've got an older egg, we've got an older woman creating pregnancy, and most of the women I see these days are older. I mean, I was in my 30s when I even thought about trying to conceive. So getting those healthy swimmers is so important, and lots they can do. So get your partner on board.
I did a stat on my age groups in my practice, and about 80% of my patients are over the age of 38. So I am dealing with a lot of older eggs, and that usually comes with older partners as well. So we've got older eggs, older partners, and older sperm. So we really want to maximise the health of that egg, even though it is older, and the sperm, so that we can create the best embryo for you in the lab.
Yeah, and there's so much you can do. So don't get disheartened by age. Yes, you know, our fertility declines as we age, but there is so much you can do in those 90 days that you can both do in those 90 days to be able to create that healthy egg and that healthy sperm, that IVF can be a success for you, because it's not a magic bullet.
No.
It's not going to work. Your equipment here and your technology is absolutely amazing and state of the art, and it's going to give the egg and sperm the best chance possible. But if you haven't gotten a great egg and sperm, we still can't get a great outcome. So, you can be proactive before you go in for your appointment in this beautiful clinic and create those healthy egg and sperm, then you've got a far better chance of getting a good outcome.
And what about Coenzyme Q10? There's a lot of talk about that. And I read an article about adding it to the culture media and potentially improving egg quality. So what about Coenzyme Q10?
Yeah.
Why is it so important?
Because we produce a lot when we're younger. We produce a lot of coenzyme Q10. I was just talking about my 8-year-old before. He's probably producing bucket loads of it because he bounces off the walls. But we produce it in our body. So our body naturally produces coenzyme Q10. However, as we age, we produce less and less coenzyme Q10. And coenzyme Q10s, if you think back to your old, year 12 biology, it's in the Krebs cycle. So it's really part of that cellular energy. So it's a fundamental part of helping your body create energy. So I recommend coenzyme Q10 to all of my older patients because they're naturally not going to be producing as much coenzyme Q10, which is important for the mitochondrial energy of every cell in our body, but particularly for an egg, that contains more mitochondria than any other cell in our body. So it's a real powerhouse. So it needs a lot of coenzyme Q10 to fuel that energy, which, as we're talking about, helps then to go and create a pregnancy, because so much energy is involved in creating that spark, creating that heartbeat, creating that fertilization. It needs a lot of energy. So coenzyme Q10 helps to facilitate that energy.
And what about ubiquinol? Some patients get confused. Do I take coenzyme Q10 or do I do the ubiquinol?
I got asked that the other day, and look, they are interchangeable terms somewhat, because ubiquinol is a form of coenzyme Q10. It's one of the highest absorbed CoQ10s. So yes, you want to take your CoQ10 ideally in the form of ubiquinol, or there are some supplements on the market that have been optimized because coenzyme Q10 in general is a difficult supplement to metabolize. It's a difficult nutrient to metabolize. So we want to get it in the best absorbed form possible. So unfortunately, if you are going to your big bin warehouses and things like that, your cheapest form of CoQ10 will definitely be the poorest absorbed. You do want to look at your higher end supplements to get the best absorption.
And tell us about buying your vitamins at a big pharmacy. Why would you say that may not be the best idea to purchase your vitamins from there?
Look at the back of the packet is the best advice I can give anyone. For example, like we were talking about iron before, constipating people. I mean, if you take iron in a ferrous sulfate, it's a very raw, very cheap form of iron. Iron's a heavy metal. It's going to cause generally constipation in most people. And what they do is, because they know it's poorly absorbed, they put a big whack of it in there. We really shouldn't be taking more than about 40 milligrams of elemental iron. That's the upper safe limit as recommended by Australian and New Zealand guidelines. But a lot of supplements will contain more than that of quite a raw, harsh form, and it's likely to just cause you issues rather than actually getting to your bloodstream. So I recommend about 8 milligrams of a iron amino acid chelate, which is better metabolized. So it's really if you're going into a big, chemist, sort of a warehouse type environment where they do have cheap vitamins in dump bins, pick it up and just have a look at what's on the back of the packet, because it might not be in the best absorbed form, which is not going to be doing your body any good. And for things like omega-3, EPA, DHA is really important, particularly for egg health that's involved in the egg cellular wall of all our cells, and also for sperm health. The heads of sperm contain a huge amount of DHA. But to get your fish oil from a big dump bin, fish contains heavy metals, and we've talked about even eating fish. So there is TGA legislation that says that they have to be below a certain level. But for me, and when we're talking about fertility, it doesn't just need to be below a certain level, it needs to be clear. It needs to be free of any toxins or heavy metals that are in the environment in which that fish oil is being collected. So I only use practitioner supplements that I know are clear of any of those heavy metals, because that can unfortunately influence egg and sperm health. So you're trying to do the right thing by taking these nutrients and you want to be getting a really good quality when we're talking about fertility.
What about probiotics and gut health? There's a lot of talk about gut inflammation and causing miscarriages or causing infertility. I know I check all my patients for celiac disease because celiac disease has been shown or linked to infertility and miscarriages. What about overall gut health? What would you recommend to help gut problems?
Overall gut health is super important to fertility. And so I do, in my consultations, I ask a lot about gut health. I ask a lot about everything, actually. I spend probably about an hour, if I'm talking to a couple, it's probably about 75 minutes, really going back through her whole history, looking back to even her mother's pregnancy, because that's when her eggs were developing. Was her mother smoking? Was there any complications? Was there preterm birth? What happened in infanthood? Was there any eczema, asthma? Was there any inflammation or immune issues, which we know are a problem? Was the immune system overreactive? And I also go through to gut health. What was your gut like when you were younger? What is it like now? Is there bloating, any constipation, heartburn? Those sorts of things give me a lot of information, as I said, about zinc. If they're getting bloated, which I have a lot of patients say, I feel skinny in the morning and I'm fat at night. Like that's a big indication that your body's not producing enough enzymes to break down your food properly. So the food's going in over the day, it's just sitting there, it's not properly being metabolized and broken down. That can affect inflammation, as we said, because food can be even getting across that leaky gut type syndrome that's getting across the gut wall, causing antibodies and the immune system to react to these things that aren't meant to be in the bloodstream. So if it's inflammation, it affects reactivity of the immune system, and we, NK cells, and we don't want any sort of reactivity when we're talking about implantation. It can also affect absorption of nutrients. If you're not digesting and metabolizing properly, you're not actually going to be getting your absorption of nutrients. So it affects so many things. And even 70% of our immune system is in our gut. Our gut is so important. So looking at that gut health is something I always do for my patients. So probiotics, in general, I'm quite specific with my prescription of which probiotic strains I use depending on the situation. But a good general one, I know L-Plantarum is one I use a lot because it's an anti-inflammatory. So I use that a lot in people who've got quite reactive guts. They might get diarrhea, they might get constipation. It's very variable and they're a bit sporadic. They want to just soothe gut down. So L-Plantarum can be a good one for that. There are some more specific ones I may use for thrush, and if you're getting candida infections and things like that, Biomedica, Femex is a really good one for that. It can be used topically as well as internally. And I had a patient that I got her pregnant on that, and she just emailed me actually not long ago, just said the bub's 3 months old, but I've got my thrush back. Can you please, just send me that supplement? It was just so awesome. It cleared it up for her.
Did she use that vaginally?
Yes,
supplement?
both. She used it vaginally and orally, and she'd had chronic thrush for as long as she could remember.
Yeah.
And we got that sorted. We got that fixed. A few other things I work with her, and she'd been trying for a number of years. And then she came into this clinic. Actually, I sent her here. Once I'd got her all prepped and ready, sent her into you guys in first round. And that's what I want to see. With any of my patients, when I send them into the clinic, I want them to go, okay, this is it. Here you go. Let's get you pregnant. And fortunately, that was for her. But the thrush really just fixed it up really well, just with getting that good probiotic and fixing her gut.
And thrush can be linked to sugars and diabetes. So I think people forget how much sugar they actually have in their diets. It's very easy to have one sugar in your coffee, and by the end of the day, you could have consumed quite a lot of sugar without really realising it. And what effects does sugar have on your health?
Sugar affects egg quality, affects hormone balance, affects uterine receptivity. There's an episode I did on my podcast about uterine receptivity and the diet and uterine receptivity. And the Professor Gemma Evans that I spoke with, she's doing amazing research into the impact of sugar on the uterine environment and that reactivity and getting that lining nice and healthy. So definitely minimising sugar. If they do have issues, I will look at their insulin, their fasting insulin, or get a glucose test. But in general, keep sugar to a minimum and lower the glycemic index of your food where you can. So, for example, fruit's quite high in sugar, but it's not bad for us. But having your fruit with some nuts, or having some coconut yogurt, or just having some good fats, or some protein in there as well, can lower the impact of that sugar on your bloodstream. So we just don't want to be having those spikes in blood sugar. And again, prevention is better than cure. I've got a patient at the moment, her fasting insulin was 31, which is quite high.
Yeah.
And she got told by her GP, look, it's fine, we just got her pregnant, which is fantastic. Oh, that's fine, we'll just treat you when you get gestational diabetes later on. Yeah. I'm like, no.
We don't want diabetes.
We don't want to happen. I don't want you treating you when we can actually fix it now. So we're doing a lot. Inositol is fantastic for egg quality. So women with PCOS often have glucose issues. So inositol has been shown, lots of studies to show that it helps with egg quality and also helps with that glucose, that need for glucose. Because if you've got sugar cravings, it's really hard to just switch them off. It is something biologically that your body is shouting out for that sugar. So we need to just get your hormones better balanced. So I look a lot with hormone balance in PCOS, and inositol is something I'll often use with them. Often use a powdered form that they can put in their water bottle and drink over the day.
Oh,
so it continually stabilises their blood sugar.
And how much should a patient take?
Look, it depends. You can take up to 6,000. 6 grams of inositol. It depends on your gut tolerance too. It can cause some diarrhea, so be careful. Yeah. So I usually start them off on a lower dose. Yeah. And that's why gradually having it over the day can be helpful too for the blood sugar balance, but also for that gut tolerance. So I recommend I start off with my patients usually about a quarter of a teaspoon in a water bottle over the day. If that's fine, we can gradually up it. And the one that I use, 2 teaspoons would be equivalent to 6 grams. So they can gradually up it to the 2 teaspoons if they need to.
And where do they get this from?
Again, it is a practitioner product, so I don't use over-the-counter supplements very often just because of the quality. Yep. So this is something, I see patients via Zoom, so I upload them to a company called Vitally, and they just send them out to them. So all my prescriptions get uploaded, they log in, and they all get shipped. So it's very COVID friendly at the moment as well.
Yeah,
so
some
nice
of my
and
patients
easy.
have said they've had trouble finding it. So
right, it is probably something that you won't be able to find in your local pharmacy. Yeah. So I just prescribe it to them and they get shipped out.
Yeah. Let's talk about the Dirty Dozen. What is the Dirty Dozen?
Yeah, the Clean 15, the Dirty Dozen. I do love to give this to my patients because we know organic is better. Yeah. And there's nothing, I guess, whiz-bang about organic. People say, why is it better? Well, basically it's better because it's the way we're supposed to eat food. It just doesn't have pesticides on it. So, but getting organic for everything can be really difficult. So I do recommend getting some of those organic boxes delivered and things like that. Make it easier for you. But in general, the Clean 15 and the Dirty Dozen is a guide to the foods with the highest pesticide load versus the ones with the lowest pesticide load. So not all of those foods are on there, obviously, but it gives you a good guide. Okay, well, those foods on the Dirty Dozen list are the ones that I really should aim to get organic wherever I can. And the ones on the Clean 15, they're the ones that have the least pesticides, so I can probably afford to get more conventional sources of those. Now, in general, it's the more porous fruits and vegetables that are going to absorb the pesticides. And there was a skit on Play School the other day that I refer to, obviously unfertility related, but they put a stick of celery in a cup of food dye. And it was blue. And so it turned the stick of celery blue. The whole food dye went right up through the celery. And unfortunately, with vegetables like celery that are porous, that's what's happening to the pesticides. So they're soaking up all those pesticides. So we can't wash that off, basically. Whereas foods like eggplant, corn, bananas have that thick outer layer, which is going to mean they're absorbing less of those pesticides. So they're the ones on the Clean 15 and the other ones on the Dirty Dozen. So that list does get updated regularly. And I also let my patients know, just get the best source you can because it's more, unfortunately in Australia as well, we have a lot of land on which to grow crops. So our crops are unfortunately generally more sprayed and things than perhaps places in Europe where they're working with a small patch of land. Yeah. They don't need as many chemicals to control that small patch of land compared to the acres that we have. So instead of getting it from a bulk supermarket or things like that, a local grocer or a farmer's market or just getting from a smaller producer will often itself have less pesticides.
A lot of patients ask me about intermittent fasting. Is that safe while I'm trying to get pregnant? Because I do need to lose weight. We know that weight affects your fertility. What about intermittent fasting? It seems to be very popular right now.
Doesn't work for everybody, and I don't recommend it for everyone. But yes, in general, it is a great way to help to lose weight. It helps restrict your calories, and it's good for egg quality too. So I recommend most of my patients who are looking at weight issues finish eating by 7 or 8 p.m. at night. Mm-hmm. So there's 2 reasons for that. It's the intermittent fasting, you generally snack, so it's minimizing the snacking, having 3 meals a day, and also allowing your body to rest and heal overnight. I mean, I know, melatonin is so important for egg quality. That's why we, can supplement with melatonin to fuel that natural melatonin in your body, but producing it overnight is really important. If your body's digesting and absorbing and metabolizing, half the night is spent with your body in some sort of stress, because food is good for our body, obviously. We need it to fuel and get to, all our nutrients. But when you think about it, lots has to happen when we're eating. Yeah. Glucagon needs to be released. Insulin needs to be released. The body's doing a lot of work to get all that happening. So giving your body a break can be really helpful. So it minimises snacking, helps with weight loss because you're generally minimising the volume of food you're eating, and it gives your body that lovely rest overnight. So I recommend for patients that I see it's going to be useful for and who do need to lose a bit of weight, an 8 to 10 hour eating window. So for example, having breakfast around 11 a.m. and finishing eating by 7 or 8 p.m. at night.
And that's not that hard to do.
It's not that hard to do, and actually often easier to do than calorie counting and things like that, which I find ridiculously frustrating. And I never recommend calorie counting to my patients because it is so tedious. But having that narrowed window can be an easy way to minimise your calories and also support that egg quality and that rest and rejuvenation overnight.
And what about exercise and trying to get pregnant? Because a lot of my patients worry they've been running, they do a lot of running for exercise or high impact exercise, and then they're worried after an IVF cycle that maybe the embryo might fall out or something. How do you advise your patients in regards to exercise?
Exercise is really important. I don't recommend the sort of high intensity classes after a transfer or things like that. Look at yoga, look at Pilates, going for a jog and things like that is usually not a problem. But some of those HIIT classes, I love some of them, but they are very vigorous, intensive exercises. Prior to a transfer and getting egg quality, the intense exercise can be great, short bursts of high intensity exercise. But post a transfer, I recommend more things that are going to stimulate circulation, help with blood flow, like yoga and Pilates and those sorts of lower impact exercises.
And I think it's very important to reduce your stress as well around that time, whilst you're trying to get pregnant as well. As you said, you were very stressed in your job, and you found that when you gave up your job, you got pregnant. So stress does impact fertility quite a bit. So
cortisol's a hormone. Cortisol's a stress hormone, and it just takes over. And your body's not in a position, your body's main aim of our body, of everything that goes on in the homeostasis in our body, is to keep us alive. So if our body's feeling under threat, which is what cortisol's really saying to our body, is that this is a stressful situation, and acute bouts of stress is fine. That's what our DNA evolved on. A saber-toothed tiger runs after you, you run away, and then you're fine again, then it calms down. It's that chronic stress that can take over. It messes with your ovulation, your cycles, which it obviously was with me, because your body's saying, you aren't bringing a baby into this. We're just coping as it is. So our body needs to be in a nice, restful state, and that's why I do find myself seeing a lot of type A personalities, because they have achieved so much in their life. They're very successful in their careers, and they've achieved it by working their butt off. And unfortunately, pregnancy is not something you can, I guess, work at with the same determination for success. It actually involves more resting, more of a yin type situation, if we're looking at it from a Chinese perspective, than that yang, motivation, drive, dominance. And often these women, they'll say they're high energy, and I say, okay, what's got the energy? Is it your brain dragging your body around, or is your body actually got the energy? And when they think about it, I'm like, oh no, probably my body is telling me to slow down, but my brain doesn't want to, so I give it the whip. That's what I find is the issue for pregnancy. So it's just really working with that. As I say to them, I don't want to change your personality. You're an extremely successful, talented woman, and I don't want to change that. We just need to give you the nutrients and allow your body and nourish your nervous system so that you can still do what you want to do, but we can actually get you pregnant.
And they need to remember to spend some time on themselves as well, like meditation. I think some of the meditation apps are fantastic as a way to sort of turn off and tune out from what's going on in your life at that moment. So I think that's very important too, to have some me time and some downtime. Creating
some self-care. I actually get my women who are very driven and type A to put it in their Google Calendar, whatever calendar you happen to use, and actually schedule that meditation in. And even if it is as simple as, I call it my 10-second body scan. And look, it doesn't have to be 10 seconds, ideally a bit more, but literally just start in the that little muscle in the middle of your eyebrows. Start there. Relax that. Relax all your face, your jaw, all the way down to your toes. So it just needs to be a simple pause. Put it in your calendar, so no matter what you're doing, you've got time to spend 30 seconds to just really check in with your body. And you'll often find, actually, I clench my jaw nearly all day, or I actually have my shoulders up near my ears most of the day. So it's really just checking in with your body, giving yourself that relaxation. Ideally, if you've got time, as you said, one of those 10-minute meditations or something like that, the guided meditation would be great. But literally, if all you have is 30 seconds a few times a day, check in with your body, see where you're holding the tension and release it.
I think that's very important. Well, thank you, Tasha, for joining us today, our first podcast for Fertility Queen. So thank you for joining, and we'll have you along again, I'm sure. And thanks, everyone, for listening. And is there anything you would like to say, Tasha?
Look, always a pleasure to be here, and just to reiterate, it's never too early or too late to get some support around your fertility. So if you're just thinking about having a baby and you think, oh, it's too early, I love hearing that. It's never too early to start nourishing that future baby, which you're already nourishing now. And at the same token, it's never too late. If you're going into an egg collection tomorrow, or you're wanting to, I'm not sure if I'm leaving it too late, it's never too late to get some support around nourishment.
Exactly. And remember, it takes 90 days to create an egg and a sperm, and that 90 days is very, very important.
Yeah.
Thank you, Tasha, and thank you, everyone.
Thank you.